ideally, those ones you find inside already packaged for you by the company. Now, remember, storage of it, okay? As it takes long, these bristles harden, okay? So you will buy them, then you start brushing, then it breaks off and remains in your gums. Now, if it remains in your gums, it becomes painful, itchy, okay? And also it becomes having pus in it. So if pus collects around those bristles, because the reason why the pus comes, it is because the body is trying to push it out. So it is trying.
That's the reason why it produces pus.
It produces pus because something is left inside. Then too, sometimes if you're brushing and you notice that there is some blood, it means one, either as you said, that the gums are sick. Then two, the gums are facing resistance because the gums are always growing. Okay, so if around your teeth you have not been having dental checkups, there is something we call calculus.
Calculus. The other one translated as cavoli.
Cavoli, exactly. So if that one is hardened around this tooth, so it means this gum, for it to grow normally, it would face resistance. So if it is facing resistance, it swells, okay, and becomes tender. Okay. As you now try to brush, it produces.
My second last question: how often should a person visit a dentist?
Now, this is what I've always told people. Normally, people would be curious to know their HIV status. The same curiosity should be transferred to your mouth. So that same curiosity, you should go with it to your mouth. That I've taken long. I should go and see a dentist, because every one of us has at least one dental issue. So the problem is, in an African setting, we first want to have pain. Then we go.
It is pain.
It is now pain, let me go. Then by the time you come with pain, the price is already high. Normally in dental we say, if the problem is so minimal, their price is less. Minimal.
When it is bigger,
when it's bigger also, your part weighs. So ideally, we tell people to go every 6 months. Okay?
Every 6 months.
Because
every 6 months.
Every 6 months. That is
twice a year. Okay.
To basically do general dental checkup, remove the cavoli, which would have formed over those 6 months. Then your toothbrush, we always recommend, as I said, every
3 weeks.
It's okay.
You get a new
toothbrush.
And how should people store these toothbrushes?
Now,
because some after brushing, you put them there. There is a move on it. Then tomorrow morning.
So these toothbrushes, we have something called toothbrush racks. I hope you have seen either in supermarkets or they sell them. So there, you just fit your toothbrush like this, and it hangs there with constant aeration. So you don't have like a student in a secondary school to lock it in the case. It has to always be aerated. Okay. Then these bristles, you are seeing how they are designed. It is not just for formality. For formality. There are reasons, okay? Now these middle ones, they are generally softer than these the outer ones. Now these middle ones, they help you with the tongue cleaning. They brush it out very well, because remember, in the tongue is like a sponge. So if you use something hard, it will not easily scrap off other remaining. So these middle ones are always for the tongue, situated very well.
Then my last question, it will go to
Mr. Sharif.
Mr. Sharif.
Yes.
What advice, what food stuff should people avoid taking, or should regulate? That would be the best word. Should regulate taking to avoid dental issues.
Okay, the most dangerous type of foods are basically very sugar concentrated carbohydrates.
Sugar? Repeat that so that I can get it right.
Very concentrated sugar, carbohydrates. Because all carbohydrates contain sugars, but some of them contain a high level
of sugar.
Yes.
Oh, for example?
For example, literally sweets.
Sweet.
Yes.
Sweet Pepsi. Sweet.
Sweets, lollipop, and all those
and
type
the
of
others.
Yes, and generally sugar itself.
Sugar. So if someone is to take sugar, he should replace that one with honey. Honey is okay.
Honey is relatively okay because
it's a natural.
Yes, it's a natural sugar. So the concentration of the simple sugars is a little bit lower.
Oh.
Yes.
Last words to our viewers.
So we recommend, or personally I would recommend, that we regularly check our teeth to prevent a situation of going to the dentist in strong pain, and it also helps with reducing the prices of treatment.
Yes.
Mr. Omara.
Me, my last word would be that once you see you have dental issues, as we consider the mouth as the mirror of your general health, okay? So if we see your mouth is dirty, it means you have problems inside your body also, okay? So you take it a key priority. The same way you are curious to check for HIV/AIDS status,
But
it's
they
the
should
same
still
way.
check for
Yes,
HIV.
it's the same way you should also check for your dental status. Thank you very much.
Thank you for watching.